Hi guys, it's Dr. Kujish again. We are actually doing something different now. We're creating a new video series and it's called Secrets of Patient Satisfaction. As you know, All Saints and all the hospitals in the United States have been working on improving their patient satisfaction scores, and we've actually done remarkably well. I think over the last 4 or 5 years we've actually gotten our score up to the 75th percentile, which is huge. So as a next step, we're all trying to figure out what can we do to make it easier for all of the providers to take it to the next level. How can we show everybody what it takes to be at the top? And we're kind of scratching our heads on this because, you know, we can read books, we can do instruction, we could have people come by and tell us, but really, wouldn't the easiest thing simply be, let's watch the docs that already have it figured out. And we've all got doctors in our departments that do an exceptional job. We've got people that are consistently at the 90th or 99th percentile for patient satisfaction. We all have them walking up and down the halls. They're at every department, but we don't know what kind of magic they're doing when they enter into that patient room because the doors are closed. So rather than trying to figure it out, what we thought we'd do is we asked for volunteers, and we picked some of the highest patient satisfaction achieving doctors, and they graciously agreed to be videotaped. The patients agreed to the same. So what we did is we created a series to make it easier for everyone to see what it takes to be a really high patient satisfaction score. It's kind of like the same idea as with swimming. I mean, somebody can come up to you and tell you, you put your left hand out, then your right hand, then you kick a little bit with your feet. But it's so much easier just to show you a video of somebody doing it in the water, and then you could imitate it. So this should help everybody out. We're going to try and do it in the primary care sector first, and then potentially spread it out to the specialists. And the physicians that were nice enough to volunteer, I want to thank everyone. Dr. Gullberg, Dr. Crevier, Dr. Lopez, and Dr. Durbin. These are folks that perennially they're always at the very top of the game. So what we did was, we actually put a camera, kind of like a candid camera, we put a camera in the patient room, patient consented to this, and then we videotaped the entire office visit. We actually videotaped almost the entire day. Then we had the pleasure of watching dozens and dozens of hours of videos to save everybody time. We're going to edit the videos down to really kind of show you the key points and the key things of value. And we're actually going to have little edits on the bottom of the videos to show you sort of the key points that the physicians are doing. But just to jump ahead, it's kind of interesting what we found, because it really is sort of, we were looking for the secrets. I was kind of thinking maybe the docs were doing some kind of black magic behind the doors, and I don't know what they were doing. So we actually went in and videotaped, and here's what we found. Every doc was doing something different. And they weren't doing a lot of the classic Press-Ganey stuff that we're told. I mean, in the past we were told that you should walk in a room and for 45 seconds not say anything and let the patient talk. Well, I got to tell you, I think I watched about 20 videos, and I don't think that happened. If it did, it happened very infrequently. I know that people have told you got to go in, you got to shake everybody's hand and call them by first name. Well, some of the docs do that, some of the docs don't. But here's what we found. I mean, here's the overwhelming thing. It's a style issue. It's a style and wording issue. Some of the docs just really have a nice way of saying things, and they really have nice wording, and the patients really respond to that. So what we're going to do in the video series is we're going to show you the nuances of what the really high-producing docs do in terms of the scores, so you can see and pick up on their style cues, and we're going to make this as easy as we can. There's about 5 or 6 key things that we found, and we're going to break it down for you guys in the videos. So each video is actually going to show you a little bit of all these key points, and it'll be evident when you see the videos. But the key points, just going one by one, the first thing was personal connection. A lot of the doctors spent a good chunk of the visit talking about the patient in terms of their family, their lives, and their hobbies, so we're going to point that out. The other thing is, all of the doctors give their patients choices. When you watch the videos, it's fascinating. You hardly ever hear in the high-scoring docs tell a patient what to do. It's always, you have the choice, you can do this, or here's another option, or maybe you should consider this. It's unlike what a lot of doctors do where they tell you, you got to get this MRI and we'll see you in a week. So that's fascinating too. Some of the doctors spend a lot of time on education. We'll show you that later. One of the doctors, it's amazing. It just seems like she spends the entire visit educating the patient. It's almost like you have to be taking notes just to learn everything she's doing. One of the doctors has a totally different style. Spent the entire visit with positive reinforcement. kept telling the patient that they were doing great. Your blood tests look great. You look great. Your heart sounds great. The weather's beautiful. This is wonderful. You're doing awesome. I think in one video, this particular doctor 38 times in 15 minutes said the words, "You're doing great, you're doing awesome." And the patient loved it. So we're going to tell you about that too. The other thing that the docs do in the videos is they really make themselves part of a successful team. They say things that are positive about everybody around them. When they're sending you to a cardiologist, they're not sending you to any cardiologist. They're sending you to the best cardiologist they know. It's a cardiologist they know. When they send you to physical therapy, they're sending you to the best possible therapist. That puts them in the best light. The other thing that's interesting in the videos is that the patient really directs what happens during the visit. So the patient may show up for a physical, but the visit may go a completely different direction, hit on 10 other points. You never see the doctors telling the patient that you're here for a visit to do a physical. It just doesn't happen. Very patient directed, and we'll show you that too. And the last thing is empathy. It's amazing. The highest scoring doctors always look at the patient and go, I know what you're talking about, or I know how you feel, or I tried to lose weight too and I couldn't. So those are kind of the key things, and we're going to point this all out to you in video. We're going to make it as easy as you can. We're going to have little bullet points on the bottom and arrows and stars. If you just watch the videos, I promise you, you're going to pick up a lot of valuable information on how to get your scores higher. Your patients will be happier, you'll be happier, and now the way the insurance companies are going and Medicare, that's tied together to everyone's pay and reimbursement. So watching this series may actually make you more money. So you can't beat that. What we're going to include now is a sample video from Dr. Gullberg. He was one of the first physicians that was kind enough to do this. It's actually a collage of 4 or 5 different patient visits. This is just to show you the style of the videos. And what you see on the bottom of the screen is those 5 or 6 key points. And every time he hits one of those key points, it's going to be pointed out to you. So take a look at it. And the interesting thing is how subtle it is. It's not like he's really pounding these things home. It's a very subtle style. It's a wording. And Dr. Gullberg he's one of the highest loved and scored doctors here when it comes to patient satisfaction. So I hope you guys enjoy the video. Take a look. I hope you watch the whole thing. And what we'll do is, every week or two, we will actually analyze one of the physician's office visits from beginning to end. We'll send you the uncut version, and we will show you all of the key points that they do. So this way, you guys can see what it is that does and doesn't happen behind closed doors. So it's kind of, the secrets. I mean, you are getting to see behind the scenes what it is that the best physicians here are doing so that you can learn. And the interesting thing is, you could imitate what they're doing. I mean, there's nothing there that every single one of us can't do. It's a style thing. So I hope you guys enjoy the video. If you have any questions, let us know. Thanks.
Well, I have to wear something in my underwear every day.
That's frustrating.
Yeah, it is. And I don't know if that's
Not normal.
somewhat of is what?
It's not normal. It's not normal, but it's very common.
Oh.
I mean, a pelvic exam is probably reasonable for you, just to have it checked sometime.
Mm-hmm.
Make sure you don't have something called like a cystocele, or where your bladder's falling a little.
Oh.
So I would have you see.
Could it be because of my weight here pushing on anything?
Yeah, they can contribute, but that's not everything. So you could consider seeing a gynecologist for that, to have a check.
Cystocele.
Just to make sure you don't have a hernia in the pelvis.
Oh.
It's very common in women.
Oh.
If everything is, the other thing to consider is just medication to try to, help with urinary retention. So that's something that we have samples that we could give you for that if you want to try. So the only thing I would consider would be, again, if we get your weight down
I know.
slowly, even if you could lose 10 or 15
I
pounds in
know.
the next 6 months.
I know.
But it takes a lot of work because of the insulin.
It does.
So you'd need to probably retool your eating. I can give you a diabetic diet again to look at.
Yeah.
Which is easy.
Yeah, I'd like
You can
that.
do that on your own.
Yeah.
And but you just need to change some of your habits. I mean, obviously.
And it was going to be for life, and I don't want to do that.
Okay, so they must have miscommunicated to you about toe fungus.
Okay.
So onychomycosis, which is what you have, is we treat it either once a day for 3 months.
Okay.
That's it.
All right.
Okay, or you can take a medication once a week for 6 months. That's it.
Okay.
It's not.
It's not something that I have to take?
No. You don't have to do anything. I mean, in other
Yes,
words,
this
your-
is true, right.
Your toenail fungus is
Yeah.
minimal.
Yes,
I see,
it is.
On a scale of 1
Like
to 10,
half of this
on a
fell
scale of
off.
1 to 10, it's a 1 or a 2.
Okay,
So I mean, we see much worse, but it is there, and if you want to be treated, it can be treated. The other option is laser, so
okay.
you can get a laser treatment. The podiatrists are doing lasers now.
Oh,
The heat kills the fungus.
Okay,
Taking the nails off doesn't cure the problem.
because it's
The-
under.
It lives in the bed of the nail bed.
Okay,
So taking nails off doesn't work.
okay, yeah,
So think
and I
about
use Tinactin
Uh-huh.
now symptomatically,
Okay.
so.
All right.
that's
So
it.
you decide what you want to do, and
Yeah.
I'll help you with it.
Okay,
The wellness program on Green Bay Road, they do a nice job.
oh,
Yeah, there's
okay,
one-on-one coaching.
okay,
You'd like it. If you want to, that's where I went
okay,
and dealt with. RNs run it.
okay,
They can give you a brochure on it if you want on the way out.
okay,
They do a very nice job. It's one-on-one,
all right,
and if you're kind of stuck and you want to get down to 135 or 130
yeah,
or something.
yeah,
No?
yes, that would be great.
Mm-hmm. Yeah, I would consider it. Done Weight Watchers or anything like that?
I did once a
Just
long,
don't-
long time
yeah.
ago.
Don't want to go through that?
Yeah, it's, most of it, I know. And
I know you do.
Yeah, and that's
This
all of it.
this isn't a
This-
brain
yeah,
issue.
It isn't. And, being vegetarian also throws some of those factors in there.
Right, so but you're
Yeah.
still,
Yeah,
still bread is an issue,
Yep,
right?
it is, exactly. And, bread is something that substantiates and holds you over, but too much of that. And it's a lot of sugars.
Wheat Belly's a good book for you to read.
Okay,
You ever heard of it? Wheat Belly?
no.
Yeah,
no.
it's basically, the capture, wheat's addictive is the
It
bottom
is.
line. So wheat, which is in crackers, noodles, pasta,
Yeah.
bread, you go to Panera, you go anywhere where there's bread, it's
Yeah.
addictive.
Yeah, tortillas always get
Tortillas,
this,
that's right.
yes,
So
exactly.
Yeah, so the Hispanic population deals with obesity
Yes.
because of corn.
Yeah, and they eat massive amounts of corn.
There's tons of sugar in
Yeah,
corn, right?
Yeah, there is.
So it's a cultural thing. The Italians deal with it because of pasta,
Stuff, yeah,
right?
Yeah.
So, it's a constant battle.
yeah,
So, anyway, Wheat Belly is the name of the book. I think you'd really like it. Just,
I
it'll,
hate those, I don't know once a week.
I'm impressed that, I've got many patients that do
Yeah.
acupuncture. I'm
Yeah.
impressed that it is helpful.
Yeah, and the woman, she's a nutritionalist, she's, got her doctorate, she's good, she's
Where's she
definitely.
at?
She's in Milwaukee, about 2 miles down from St. Luke's,
Nice.
so, yeah. So,
How'd you find her?
actually, my daughter is working with her. Heather, the one
Okay,
that
sure.
does the massage therapy,
Sure.
is working with her,
Oh,
so
okay,
she goes up.
I think she
yeah,
mentioned that.
yeah, so, she's like, Mom, you just need to go in and at
Cool.
least talk to her. So I did, I set up a consultation, so, but doesn't mean that I'm not gonna still practice. I know where medicine fits, so
No, well,
it is.
I think you just gotta do it, everybody's gotta do it a little, I
Yeah.
mean, everybody has an option as to how to treat their bods,
Right.
and, there's no reason you can't use both.
Right, exactly.
I'm open-minded. to that.
Yes, and I know you are, and
Mhm.
and Dr. Core has been the same way for me, which is great.
Yeah, I'm all for whatever improves your quality of life.
Yeah,
If you find
yeah.
something, I think it's humbling to know that the human body is so complex.
It is.
Right?
It is.
Well, we know there's electrical magnet waves going
Yeah.
on. So I've got a lady, in fact, right now, I'm trying to figure out how to help her because she can't deal with computers. Anywhere where there's electromagnet, waves and stuff,
Uh-huh.
and she gets sick from it. basically you're gonna mummify your foot all the way up to here, and you're gonna. I know you don't like it, but you gotta.
Yeah, he says he
Do you need
can't stand
pain
it on,
medicine?
yeah, so.
You need pain medicine.
Marijuana. No, I don't have anything.
Would
I-
you like something?
Yeah.
Yeah, I suppose.
What would you like?
Something that
Something
I
that
can,
keeps them
something
asleep.
that I can take